I'm Yvonne Miller. I'm the Director of the QUT Design Lab. It's the research centre in the School of Design here at QUT. It's focused on how we might redesign environments to foster health and well-being. We brought together doctors and designers to reflect on the current state of healthcare and how we might redesign it.
One of the important things in planning for the future of healthcare is really looking at where we are now and acknowledging that the way that our systems are designed are not working for us now. The heavy emphasis on hospital-based treatment in our healthcare system is just absolutely not sustainable into the future.
Our system as it is easy to navigate if you know how to do it, but probably the only people who might know how to do it are people who work in it. So for patients who come in off the street, I think it is pretty difficult to understand what the path is to their wellness. So it would need to be inclusive and flexible to the individual's needs.
So at the moment, a lot of healthcare is either automated but one size fits all, or very personalised but very, very labour-intensive, manual, work and everything like that. So through 3D scanning, 3D computer modelling, and 3D printing, we can start to develop bespoke, one-off, personalised, 3D printed solutions for different health problems, and do these in an automated way, lowering health costs and improving precision and things like that.
I think there's two ways to think about that. One is that technology will solve all our problems, and the other is that there's a role for human beings in this as well. And I think the future of healthcare is about finding that balance where we use technology to innovate, but we also have really empathic, kind of person-centered care at the heart of it, because that's really irreplaceable.
I think what I would do in terms of rethinking the healthcare system, I would move it towards a more people-centered approach. So I think a lot of focus has been on technologies, but in the understanding of those technologies, we still need to understand that there's people and patients on the opposite end of those.
Australia is a very multicultural country, and we have people from over 280 cultural groups and nations, as well as Indigenous Australians that bring a different cultural perspective to spaces. So engaging different participants in that co-design process, which can give different viewpoints on how we can design a truly inclusive space, would be fantastic.
What will be interesting is as we see new technologies come into play and all these changes that are coming in AI and robotics and all the rest of it, perhaps that'll help us understand a bit more about what actually healthcare is and what care is and how important are humans really in the process.